Hi, I'm Dr. Steve Bender. Today we'll be talking about using the George gauge to take a protrusive bite record for fabrication of a mandibular advancement splint. So let's look at what comes with the George gauge here. The George gauge will come in a box like this, and it will include a set of instructions. And then once you open the box, you will see there will be a main body of the George gauge. It has two thumb screws that loosen. This lower portion here will move forward and back, and this is used to be placed over the lower central incisors and then snugged down like so. In addition to the main body of the appliance, the box will include 4 bite forks. You have small size and the large size, and you have a gray colored bite fork and a white colored bite fork. And the difference between those is the gray bite fork is a 2mm bite fork, and the white one is a 5mm bite fork. And that will be the distance between the upper incisal edges and the lower incisal edges when the patient bites into the bite fork. The bite fork then goes into the main body of the George gauge on top here, and as we see, once that bite fork is in place, it will scroll back and forth across the millimeter measurements that you see on the main body of the George gauge. Okay, now that we have gone over the parts of the George gauge, let's take this to a patient's mouth and see how this all will work. Vanessa here has agreed to be our victim this morning, and so we'll get her to cooperate to demonstrate this. I'm going to take the main body of the George gauge and leave the lower unit so it's nice and loose here. And we'll take that to the mouth here, Vanessa, if you just open. And I want to center that right over the space between the 2 lower central incisors, snug that up against the incisors, and then tighten down the lower thumb screw. And that will fix that so it just nicely fits over her lower incisors. Then we'll go ahead and insert the bite fork. And my personal preference is I prefer to use the smaller of the bite forks. It also comes in the 5mm dimension as well. For most cases, the 2mm will be just fine. If Vanessa had an extremely deep bite, class 2 deep bite, and had an extreme curve of spee, we might want to choose the 5mm bite block to give the laboratory a little bit more room in fabricating the appliance. But in this case, the 2mm bite fork will work fine. Now, in a situation if Vanessa's 2 upper front teeth were very, very crowded, we might go into this area here. Do not touch the front portion of the bite fork at all, but you can relieve the rear portion here of the bite fork if the teeth were overlapped, so that it seats all the way up so the incisal edges fit down into that notch. In this case, Vanessa's had orthodontic treatment, her teeth are nice and straight, and so we don't need to do that. So now that we have the bite fork in place, we're going to go back to the mouth, fit the lower portion over the central incisors, move the upper incisor notch back to line up with her upper front teeth, and go ahead, Vanessa, and just close down into that. All right. Now we can see we have the little mark on the upper bite fork here aligned with the space between her 2 upper front teeth. Now I'm going to ask you, Vanessa, to take your lower jaw, and I want you to push it out towards the window here as far as you can go, and all the way back in. Once again out towards the window, and all the way back in. And one final time, all the way out, and all the way back in. Okay, now I like to have the patient do that 2 or 3 times, and what we're assessing here is her protrusive range of motion. And we can see on the gauge here that protrusively she could go from a +5 all the way to a -5. So her range of motion here is 10 millimeters. And what we're going to want to do here is, in Vanessa's case, we're going to want to set this at about 60% of her maximum protrusion. So we'll go and we'll set this at a +1. And then we'll go back here and try this in over the central incisors again, and go ahead and bite right down into that notch. Okay. And we can maybe see from the side here how protrusively this has her forward. And this is about 60% of her maximum protrusion. Typically then I will have the patient sit and hold the bite fork in place like this for several minutes. And what we're looking for here is to see if we've got any tension in the TMJ area here, or any discomfort for the patient. If for several minutes they're able to sit there in relative comfort, then I know that we're probably safe in using this as our final bite registration. So, open again. So now I've got the thumb screws tightened down here. We have the George gauge all set and ready to take our bite. There's going to be 3 different options that you have for taking a bite. I prefer to use the Part A, Part B putty. You can also use the injectable polyvinyl siloxane, and we'll show all of these options here, providing Vanessa will cooperate with us. Okay, now that we've determined our protrusive setting here at 60%, we'll go ahead and take our bite. Typically I will go back into the mouth and go ahead and close into the pliance. There you go. Open and close into the gauge. And I'll have the patient practice 2 or 3 times here just to make sure that they feel comfortable opening and closing. One more time and close. Okay, we've got things lined up, and with this technique we'll use the injectable polyvinyl siloxane. You can pretty much use any brand that you're comfortable with. The little heavier body material works the best. And I just retract the cheek. We've already got her in position, and we just start injecting here in between the teeth all the way around. And you're better off to err on using quite a bit of material in here and injecting it with pretty good force in between the teeth. Doing this technique, sometimes you won't get the polyvinyl all the way in between the teeth unless you really inject a lot of it. So we'll have Vanessa just sit and hold together there while that material sets. And what we'll be looking for here is, I think it's important to try to capture the occlusal surfaces of all the posterior teeth for as much stability with the bite that you're going to send to the laboratory. This sets pretty quick here, so once that's good and hard, go ahead, Vanessa, and open. Go. And now we have our bite registration. As I said with the injectable here, I could have injected a little bit more to capture the posterior teeth. On the bottom we certainly have a good registration. The top is a little bit lacking here, although we've got enough to capture what we need to seat our models in there. I typically will take at least 2 different bites, and then once the patient's left and we have the models poured, I will check both bites on the models and choose the one that I feel is right on as far as the midlines. So that would be all there is to it. You then loosen the upper thumb screw. You can remove your bite fork. There's a little scored line on the underside. What I typically do is snap that off. I will take a Bard Parker and trim this up a little bit and put that in a separate baggie, and that goes to the laboratory along with the models. Go ahead and open up. We'll seat that down over the lower central incisor. Just close gently into the upper notch. Alright, we've got things lined up, and open again and close and open one more time nice and wide, and then just close down. Here again, with this technique, I'll want the patient to practice opening and closing 2 or 3 times so they're comfortable and can reproduce biting into the notches and having the midlines line up. Okay, go ahead and open. This technique is done just a little bit differently using the same injectable polyvinyl siloxane material. What we'll do here is, first of all, I will inject onto her lower teeth without the George gauge bite or George gauge in place. And I want you to just stay open here for us. And then we'll take the top portion and we'll inject our polyvinyl on the top surface of the bite fork. And then we'll seat that down on the midline and go ahead and just bite right together for me. And she's biting right down just the way we want here. Perfect. All right, and once again, we're going to let that material set. And typically these bite registration materials will set very quickly. So quickly, in fact, that sometimes it sets up before you can get it all in the mouth. Mm-hmm. All right, Tessa, go ahead and open for me. Okay. And now when we look, and we'll compare all of these, but with this particular technique, we've got all the occlusal surfaces on the upper, and she's missing a tooth over here, but we've got all the occlusal surfaces captured on the lower. So here again, this is another way to take the protrusive bite registration using the injectable syringe polyvinyl siloxane. Okay, and the third and final way, and this is my favorite way, is using the polyvinyl siloxane putty. Any brand will work. I like the fast set, the part A and B putty. With this particular technique, because we will have a little bit more resistance when the patient bites together, I will have the patient, here Vanessa, practice 2 or 3 times closing down into the notch and open and close again. Open quite wide for me there and close down again. And open one more time and close down again. Okay. Open. And now what we'll do here is I have 2 little balls of polyvinyl siloxane putty, part A and B, and we're just going to knead those together. And I like to do this in front of the patient, and then they can see that we're just going to use some soft putty material like this. And typically talk to the patient a little bit and tell them, now when you go to bite together here, you're going to feel a little bit of resistance, but what I want you to focus on is your front teeth and biting into the notch. That's the critical issue here. All I want them to think about, I want them to disregard the putty and the sensation of resistance when they bite into the putty. I'll typically make 2 little rolls, little hot dogs, whatever you want to call them, and just skewer them on each side of the bite fork. We'll plump them up here like ballpark franks here so they're nice and big. Okay. So then we're going to take this to the mouth, and we go in and I lay this right down on the front teeth here and kind of position the little hot dogs so they're right on the occlusal surfaces. And then we want the patient to go ahead and just bite right on together until you bottom out in the notch. Perfect. And then I can go in and kind of mold the polyvinyl with my fingers here and allow the material to set. Now in my hands, this really takes a nice bite. When we have the material set, I typically will then take the George gauge out of the mouth and take a Bard Parker, and I will trim the surfaces, the occlusal surfaces down, so we just get the cusp tip indentations. It's a real nice bite. The laboratory likes these bites, and it's a nice way to do this. This particular putty does take a little bit longer to set than the injectable, even though it's a fast set putty. But it is the polyvinyl, and it's stable for weeks and weeks and weeks. Anyway. Okay. And here we have the final bite using the putty material. The thing I like about this is it really ensures that we capture all the occlusal surfaces of the posterior teeth, both upper and lower. And then typically what I will do is, because there's quite a bulk of material there, I will go ahead and take the bite fork off, break the little tab off, and then we'll get the Bard Parker knife over there, and we'll trim this. And I'll usually just trim down so that the occlusal registration is still visible. So we still have the indentations of the cusp tips here. And then I'll do the same on the lower, and if you like, you can trim some of this out. All we want is just the indentations of the cusp tips. And then I will take the casts and I will seat them into the George gauge putty registration here. And like I said earlier, I take 2 of these, and I will choose the one that I think most closely lines up with the midline as we predetermined here. Real nice way to take a bite, and is certainly my favorite. This comparison here now of the 3 techniques that we used, all with polyvinyl siloxane bite registration material. This is the first one that we did with the patient biting into the George gauge bite fork, and then we injected the polyvinyl in the patient's mouth with the bite fork in place. The second technique was injecting some of the polyvinyl on the lower arch, injecting the polyvinyl on the upper portion of the bite fork, and then seating that in the patient's mouth. And then the third way was using the Part A and B polyvinyl siloxane putty material and making the little hot dogs and skewering those on the bite fork. How I would then use these is, like I have mentioned before, we take more than 1 bite. I usually will take 2 bites, and so when we have our casts all poured, I will then take and seat the bite registration on the model. You can always put the cast together and check your midlines, And in this case, the midlines line up, the dental midlines, and they correspond with the skeletal. And so what I want to be able to do is to put my bite registration on there and see that I have reproduced that. And I think we're right on here that the midlines line up with the notch on the bite fork. And so I'm comfortable in sending this to the laboratory and feel confident then that I won't be getting a call that my bite registration is off. And then these items are all sent to the laboratory, all wrapped separately, and sent to the laboratory well wrapped so that there's no breakage in transit.